I'd just like to point out that Stella's Northern too, so it's not just me. As Andy introduced me, I'm the Head of Education Development here at GamCare, so my role is to look at how we can speak to youth more than we were doing previously, and look at how we can develop prevention and education approaches, and also look at the treatment that we offer for young people. I was invited to speak here last year as well, before I'd started working for GamCare, to kind of give a preamble to the work that we were intending to do this year. And I'm glad that I can speak here now about what we've actually done, because we have done a lot in a year. You might remember the presentation last year, if you were here, gave a lot of statistics around young people and problem gambling, sharing some ambitions and ideas about the kinds of work that we were hoping to do at that stage. And now I'm hoping that I can speak to you about the main development area for GamCare at the moment, which is working with young people. And of course, with any development work like this, the more thinking we do and the more collaboration we do around this subject, the more our ideas grow. So I'd like to just take these few minutes to tell you about some of the things we've achieved and tell you about our plans for the coming months and years. So what do we know about adolescent problem gambling? Many of you might have seen that about 2 weeks ago we released our education and prevention strategy, which is titled Beating the Odds. If you haven't seen it, it's available on our website. It aims to inform about youth problem gambling and the ways in which GamCare is well placed to tackle this issue. It comprised of a literature review and an assessment of the prevention work that's been done in the UK and elsewhere so far. And it's kind of concluded with some statements of intent about what we're keen to tackle. The literature review identified that 2% of 12 to 15-year-olds in Great Britain are problem gamblers, which equates to around 60,000 young people. We do know that that figure is decreasing from the previous prevalence survey that was undertaken, and that's really good news. But what we're trying to emphasise is the fact that there is this large number of young people who have gambling problems, and that really there's not much being done to tackle that in the UK at the moment. We also know that the prevalence rate in young people is 4 times as high as it is in adults. However, last year, less than 2% of all our callers to either the helpline or the netline were aged under 18. We had 35,000 calls last year. Many of the calls were likely to have been from individuals who were concerned about someone else's gambling behaviour. And in fact, only 67 young people gave specific details about the type of gambling that they were doing. So that leads us to wonder, are the 60,000 identified problem gamblers that are aged 12 to 15 seeking help elsewhere? And if so, are they getting the support that they need? And we think that the answer to both of these questions is likely, for the most part, to be no, they're not. Of course, there are other places that young people can seek help for gambling problems, and in some of those places, appropriate support and help is likely to be available. However, our research evidence from conversations that we've had with people who work with young people, has shown that when people turn to youth workers, teachers, parents in crisis, they don't know that gambling's an issue, and it's not really something that there's a big amount of awareness and concern about. Research has shown that less than 5% of parents will ever set boundaries or rules or guidelines about their child's gambling behaviour. And gambling's also consistently been rated as the matter of least concern when compared to other risky behaviours that teenagers might engage with, like drinking and taking drugs and sex, etc. And of course, there's also a well-established link between parental gambling behaviour and developing problem gambling. Our conversations with teachers has suggested that they feel unsupported, both in terms of information that's available around problem gambling, but also in terms of the time that they've got available to raise gambling as a potential issue, encourage discussion about the ways in which they can keep gambling fun. And many youth workers have acknowledged that problem gambling is an issue for the kids that they're working with, but in some cases we've had, I think, fairly worrying conversations that youth workers have thought that maybe this isn't an issue for my kids. And in the Northwest, when I was trying to engage some youth workers around problem gambling up there, one of the quotes that I got back was, I can see how it might be an issue, but not for my kids. It must be a problem for more affluent kids. And I think that's interesting, because if you think about the argument for drug addiction or alcohol addiction, I don't think you'd ever find a youth worker who would say, my kids can't afford to drink or take drugs, so that's not an issue for me. So I think there's a bit of a misperception about what gambling involves, and I think we need to tackle it. And it's no wonder that given this lack of awareness amongst people in positions of responsibility, that young people aren't coming forward for the help and support that they need and that we can provide. So these conversations that we've been having have helped us to identify the main target groups that we want to work with, and these are young people themselves, which is really important, but also parents and health and education and youth professionals. And to do this, we've determined two separate but very closely linked streams of work in order to engage these groups, which we've imaginatively entitled the communication strategy and the community engagement strategy. Don't get confused between the two. The communication strategy aims to develop the way that we communicate with young people and those who care for them. We're soon going to be relaunching our web presence, as has been mentioned earlier, and as part of this, we're looking at how we can provide both information and treatment that's relevant and accessible for young people via the internet. We've identified that there's an importance of looking at the way that young people are using the internet today and ensuring that we reach young people in the spaces that they already engage with online. So we're looking at using social media like Facebook and Twitter and YouTube, perhaps using interactive gaming, mobile telephony to see if we can reach our audience. And what we're also ensuring is that we get information into the public arena so that parents, kids and those who work with young people can see that problem gambling is an important issue and something that they need to have on their radar. We are producing articles for professional and academic journals, for print media, and we're publishing information on relevant websites. And it's kind of like a drip approach, trying to get as much information as we can out there so that everybody's aware that problem gambling is an issue that they should be considering. So that communication strategy is kind of going to have an impact, we hope, on a national level. But we're also working on what we've called community engagement projects to work at a regional level. We're hoping to run 3 pilot projects which are going to explore the best ways to reach and engage young people, their parents and professionals who work with them around problem gambling. And this outreach work will be supported by materials that we're hoping to produce, which are going to be specific for the project, but also specific to the age groups that we're working with, to the target audiences that we're working with. The aim is that we're going to educate around gambling responsibly, understanding what gambling is about, understanding what the risks are that are involved, how to set limits, how to control and manage gambling behaviour so that it can remain fun and enjoyable. And also we want to educate about how to spot signs of developing problems and who to talk to and where to go if you think that you or someone that you know would be developing a problem. A key aspect of the work that we're doing is evaluation, which I think is really important. And I know a lot of you have heard me speak before about how important evaluation is in this work. What we don't want to do is to run a pilot project and think we're ticking the box of doing education and prevention work. What we want to do is ensure that what we design is effective, that it's making a difference, and then that we can redevelop the model to ensure that what we're delivering is changing the way that people in these localities that we're hoping to work are thinking about problem gambling and discussing about it with their children. And of course, this work is dependent on finding suitable funding, and our capability director, Mandy Barry, our partners, some of you are here in the audience, and other people are working really hard to ensure that we're able to find the funding to continue with this work and see it flourish. And as I said earlier, we released the education strategy Beating the Odds to media a few weeks ago. It resulted in coverage in the national press, on a dozen radio shows. We had Andy on Sky News, a handful of internet news articles, and the media coverage, which was directly focused on young people and problem gambling, contributed to a 45% increase in the number of people who contacted our website that week compared to the same period the previous year. We hope that this continued work around young problem gamblers will continue to encourage people to seek our advice and our support and our help. We know that many of the people who come to GamCare for help as adults have started gambling in their teens. we hope that if we can continue the work as successfully as we have this previous year, that not only are we going to go some ways towards tackling the rate of young people problem gambling, but also in the future the rate of adult problem gambling will be less. And we know that for the vast majority of young people and adults, gambling can be fun and exciting, and we just hope that our work will contribute to making it that way for everybody who takes part. So finally, I just want to finish by saying a big thank you to all these organisations and some more who have really contributed to the work that we've done in working with young people over the past year. I know that quite a few of the people from the organisations listed here in this audience, so I'd like to give them a round of applause and thank them for their input.